Video 1. Welcome to the Leckey Mygo stander, a 3-in-1 prone, supine and upright stander for kids aged 4 to 14. As a child grows out of their squiggle stander, their standing therapy can continue with the Mygo stander, as it encourages a natural standing posture with improved function. There are lots of benefits when a child is able to stand. They can interact at the same level with their peers, as well as being more alert with improved well-being. On the clinical side, research evidence shows that standing stretches muscles, enhances circulation and blood pressure, and improves respiration. It aids digestion, bowel function, and bladder drainage. Designed around the Leckey design principles, the Mygo stander is age appropriate, has a clinical focus, is lightweight and durable, easy to use, and it looks great. The 4 colours always make it a favourite with the kids, as they can get to choose their own colour, and it comes in 2 sizes with a maximum user weight of 132 pounds or 60 kilograms in the size 2. The cushions are all removable and machine washable, and the grey option offers infection control, allowing the belts to be washed at a much higher temperature. The Mygo stander has been developed to meet the clinical needs of the child. And in the following videos, I will explain the different configurations and the distinct clinical advantages the Mygo stander has to offer. Video 2. Mygo stander 3 configurations. The Mygo stander is designed to provide standing support in 3 configurations: prone, supine and upright. Prone standing is where the child stands with their front against the stander. Supine standing is where the back of the child's body is supported in the stander. Whether used in prone or supine, the Mygo stander can adjust from virtually horizontal through every angle to fully vertical, providing upright standing. This is designed to vary the level of support provided and gradually increase the child's ability to stand more upright or to weight bear through their legs. Let's look at supine standing. In supine, pelvic positioning is provided by the supine derotation hip belt. Placing the child into the derotation hip belt is really easy, and where possible, best fit it first. This uniquely designed Mygo derotation hip belt enables the carer to position the child's pelvis in a central and neutral position with minimum effort. Starting near horizontal usually ensures that placing the child in the stander is much easier for the parent or carer. Securing the pelvis is the foundation for ensuring stability and comfort when using the Mygo stander. You can see this clearly demonstrated here with Max and his mum. In supine, additional back support is provided by the contoured shoulder and head supports. On the contoured shoulder support, the wings can be angle adjusted to ensure shoulder protraction. This brings the hands to the midline, which can increase upper limb and hand control for improved function. The Mygo stander can be used with a choice of head supports, to include the Autobock range and the Leckey wide headrest, which is custom designed for extra support. A really important and unique feature of the Leckey Mygo stander is that the angle of the knee supports can be independently adjusted by up to 20 degrees and the foot supports by up to 10 degrees. This is an important feature, allowing many children to continue their standing programme, even when they have tightening of the hamstring muscles or contractures. Now let's look at prone standing. In prone, the Mygo stander's contoured chest, hip and knee cushion supports are designed to fully support the child. The flexible wraparound chest laterals support the upper body with minimum obstruction, maximising upper limb freedom for improved function and daily activities. In prone, Pelvic positioning is provided by the prone derotation hip belt, ensuring midline positioning and maximum stability of the pelvis. As before, it's best to fit the belt before placing the child into the stander. Where additional support is required at the pelvis, flexible hip laterals provide proximal support, ensuring the child remains in a central position, and optional posterior support pad gives the child maximum feeling of security and support. Once again, in prone, the unique knee supports can be independently adjusted by up to 20 degrees to accommodate children with tight hamstrings or contractures. The footrests also independently adjust 10 degrees to accommodate plantar flexion or dorsiflexion. Either in prone or supine, the angle indicator on the Mygo stander allows standing programs to be recorded and repeated time and time again. The V-shaped design of the height adjustable knee supports ensures that a wide range of knee shapes and sizes can be accommodated in comfort while distributing any pressure. These are the key features and unique benefits of the Mygo stander, where it provides flexible, comfortable and adjustable support for prone, supine and upright standing. Video 3. The Mygo stander, clinical advantages, features and benefits. Now let's look at the clinical advantages and features and benefits that the Leckey Mygo stander can offer children aged 4 to 14 years old who want to maintain their standing therapy programme. The first advantage is that the Mygo stander can accommodate fixed hip and knee contractures of up to 20 degrees. Research shows that standing programs, if maintained, improve the extensibility of the hamstrings, increase range of movement, and reduce the extent of spasticity. Standing also provides proprioceptive input to young developing muscles and joints, builds endurance to standing, and regulates resting muscle tone. Children who stand at the normal developmental age of 12 to 16 months are considered more likely to develop the ball and socket of the hip joint, which can prevent hip subluxation or dislocation. The unique swinging footplate design on the Mygo stander mechanically links the movement of the footplate to that of the knee support. This allows the user to stand in a fully supported position with hip and knees flexed, thereby taking the strain of tight hamstrings, hip flexors or Achilles tendons. The foot plates can also be adjusted individually to accommodate up to 10 degrees plantar flexion or dorsiflexion. The result is more upright natural posture, combined with an ability to support users with fixed hip and knee contractures. The second clinical advantage of children maintaining their standing programme in the Mygo stander is the reduced load bearing on the patella. Research shows that standing programmes improve the bone density of the pelvis and leg bones of non-ambulatory children, such as those with cerebral palsy, muscular dystrophy, spina bifida, or spinal cord injury. Increasing bone density reduces the risk of fractures. The innovative V-shaped design of the knee supports ensures a proximal fit irrespective of the size of the child's knees and maximises the surface area of loading. The load is optimally distributed on the proximal tibia and is directed away from the patella in prone position. Clinical advantage number 3 is how the Mygo stander can help improve function while standing. The ergonomically designed chest pad on the Mygo stander replicates the shape of the rib cage, allowing the shoulder girdle to freely protract and retract in prone standing. Combined with a lower tray height and more upright head and chest position, the client's upper limb function is significantly improved. The supine shoulder support also stabilises the shoulder girdle. Consequently, the Mygo stander increases the ability of the user to play, feed, and communicate. When we stand, the diaphragm has more room to expand and contract, improving respiration and voice control. As standing improves respiration, it allows more oxygenated blood to reach tissues which are subject to pressure when seated, resulting in fewer pressure problems and improved skin integrity. Effective circulation is closely related to breathing, and therefore standing is considered effective in regulating blood pressure, heart rate, and improving circulation. The Mygo stander enables kids to interact eye to eye with their peers. Eye to eye interaction can improve confidence, self-esteem, and self-image, as a child can accomplish tasks in the same manner as other students or siblings. The Mygo stander has been designed to accommodate children with a larger build. Some children have a larger build often due to low tone, degenerative conditions, or restricted mobility. The innovative design of the knee and foot supports means that these supports do not have to be positioned directly in line with the chest and hip supports, allowing the Mygo stander to accommodate larger children in prone. Another clever feature of the Mygo stander is the clear tray insert, which is designed to aid communication. Sheets of written communication or schoolwork can be positioned under the clear insert to keep them in place. This is really important as it means the child can enjoy a broader range of activities during their standing programme. The soft PU tray is available with interchangeable inserts and is height and angle adjustable, allowing greater upper limb freedom and range of movement. Video 4. Mygo stander summary. I hope that you can see how the design and functionality of the Mygo stander is designed to meet the needs of the individual and their carer. This 3-in-1 prone, supine and upright stander offers standing therapy while ensuring the child is fully supported in the standing position. The Mygo stander is designed to encourage a natural standing posture with improved function. The clinical advantages, features and benefits of the Mygo stander have been created using practical solutions centred on evidence-based research and development. Accommodation of fixed hip and knee contractures and the ability to reduce the load bearing on the patella ensure that the child has greater support and helps to assist the child to stand in a more neutral position. The Mygo stander now accommodates children with a larger build who may have found it difficult to find a stander to accommodate their posture. The Mygo stander facilitates the postural needs of the child, whether it's in prone, supine or an upright position, and is now able to help a greater range of kids and young adults with advanced postural challenges. At Leckey, we understand the importance of standing therapy and the benefits that it can bring to a child. The Mygo stander has been designed with additional features to enable kids to participate in everyday fun and work activities while ensuring they adopt secure and correct postural care. For further information regarding the Mygo stander and other Leckey products, please visit us at www.leckey.com.